Congratulations, New York City Organization of Public Service Retirees. We're just going to go a little bit into y'all's Zoom call here. I want to congratulate you guys because this is a big hurdle because there's so many more employers that are trending towards retiree insurance known as Medicare Advantage egg whips, these group Medicare Advantage plans. And you guys have won your case, and we're going to take a listen. And I'm going to speak more about the trend in the shifting cost to Medicare on the Kaiser Health News after this after their video. So congratulations, guys. If you haven't seen it, or if you're a retiree and you're currently on traditional Medicare and there's something going on with your retiree health insurance, listen in to what happened to the New York City Organization of Public Service Retirees YouTube channel. Let's take a listen.
Yes, you could laugh. Everyone, as applaud for everybody, for the board, for yes, all of you guys out there, because today we won. The judge gave us our decision, and we could never have done this without all of you. We're like, what, almost 15,000 people on this Facebook page, plus like another 6,000 on our email list. So yes, it is absolutely true. We did win this case, but we absolutely did tell you that we will probably end up in appellate court, because recognizing that this contract had the potential to go to 11 years and $34 billion is pretty insane. The city's just not going to let that go. And I'm sure there'll be some other underhanded tactics that the city and the unions will probably try, but we're going to reserve that for another day, because today we want to celebrate. Yes. So, Madeline, I'm going to pass the...
All right, guys, congratulations on your court case won, and hopefully you guys will keep on fighting the good fight. Thank you guys for those who commented on some of my videos and getting some of my information correct. So looks like if you want to know more about obviously opting out, you should go to their YouTube channel, New York City Organization of Public Service Retirees, and subscribe. I am subscribed, even though I'm not a New York City retiree, but I do like it when folks have traditional Medicare as their primary. I'm just partial to that. Okay, so let's go into my email here. Seeking to shift costs to Medicare, more employers move retirees to Advantage plans, and let's go right here. And so this is the woman who was just speaking was Marianne Pitola. Sorry if I mispronounced that. A fire department retiree and president of New York City Organization of Public Service Retirees, which filed a lawsuit. The state Supreme Court Justice Lyle Frank has twice delayed implementation of the plan and has ordered the city officials to correct the mistake in the enrollment guide. Contact medical providers. Okay. City officials assured that the judge will follow through the instructions. So just note that they won the case. You can opt out without being charged, which is kind of so ridiculous. If you opted out of the Medicare Advantage plan that they are trying to force on the New York City retirees, you are being charged. So if you're watching this, please go to their channel so that way you can listen in on the how you can opt out. Okay, so let's go back to the top of this. Kaiser Health News, Kaiser brand, Kaiser Family Foundation does a lot of research when it comes to health insurance, Medicare, Medicaid. Kaiser Permanente is a health system in California. When they talk about the shift in cost, it has a lot of weight to it because they're a big player in the actual insurance space, health insurance space in the United States. So when they talk about this article, they have a lot of evidence to back it up, and I'm going to show you some of that with some of my research that I've done. So seeking to shift costs to Medicare, more employers move retirees to Advantage plans. And Advantage plans, if you don't know what that is, it's in your Medicare New Handbook, page 5. There's two main ways to get your Medicare coverage. The original way, since 1966, 54 years in existence of primary insurance for hospital and medical. It's the largest purchaser of medical services and supplies in the United States. You can go use any doctor or hospital that takes Medicare anywhere in the U.S., which means it's national coverage. Medicare Advantage has always been, service areas within the United States. Medicare Advantage is a Medicare approved plan. When they say plan, that's Medicare Advantage, HMO, PPO, network. Anything network based is from a private company that offers, alternative to original Medicare for health drug coverage that is bundled. And a lot of times they offer zero premium. That's how they entice a lot of folks. I'm not knocking one or the other, because one is trying to manage your care, and Medicare spending, is, everyone knows, is astronomical. So that's why they have the Medicare Advantage program in place to try to cut down on the Medicare spending and save some of the Medicare trust fund money. And original Medicare is just primary insurance when so many folks needed it in 1966, and to this day need that insurance. There's millions of beneficiaries on it. Both plans together is like 62 million beneficiaries. Original Medicare is about 60% of the market. Medicare Advantage is about 40%, a little bit more now, of the marketplace. But there's a strong shift that's going on with retiree plans. So, seeking to shift costs to Medicare, more employers move retirees to Medicare Advantage plans. And so, and this is referring to the New York City retirees here. Obviously, they won, which is a great thing, but they've been fighting this since last year of 2021, when the former mayor and union leaders just decided to do this. So let's read into it. So, as a parting gesture to a pandemic-ravaged city, former New York City Mayor Bill de Blasio, New York Mayor, hoped to provide the city with a gift that would keep on giving. That's obviously being facetious. New health insurance for 250,000 city retirees, partially funded by federal government. Although he promised better benefits, no change in health care providers. That's obviously wrong when you look at the Medicare New Handbook. This is service areas. Everybody knows service areas, HMOs, PPOs, if you're on group health insurance. If you look up Medicare Advantage plans on Google, you can actually see what the service areas are, or how many plans there are. So this is the number of Medicare Advantage plans in 2022. 3,834 plans. So that means 3,834 different service areas. So you always have to do check if you're in or out of the network. With original Medicare, you can use any doctor or hospital that takes Medicare anywhere in the U.S., anywhere. And it's been around the longest, so that means it has the most robust coverage and list of medical services and supplies that it covers for beneficiaries. So with that said, let's go on to it. So they're thinking they're going to save $600 million a year. Okay, so over the past decade, an increasing number of employers have taken a similar deal, using the government's Medicare Advantage program as an alternative to existing retiree health plan and traditional Medicare coverage. Traditional Medicare is the exact same term. It's one and the same when they're talking about original Medicare. Traditional Medicare and original Medicare are one and the same. It's A and B as primary insurance. 80% is covered. 80% hospital bills, medical bills, 80%. And I'll show you why Medicare Advantage is so different. This is your Medicare Advantage company. This is the federal government. They pay per enrollee into individual and group Medicare Advantage plans to the actual insurance company. They take on the risk, supposedly, and pay out for your medical services, supplies, and maybe other benefits like dental, vision, or hearing. But look at this. The more you use the plan, the more out-of-pocket back-end spending that you have. So in Medicare Advantage, the max out-of-pocket used to be 6,700. Now in 2022, it's up to 11,000 in or out of network. I don't know what that means. I thought it would just be out of network where you have that max out of pocket, but it says in and out of network. And if you don't believe me, search on Medicare.gov Plan Tool Finder for your service area. Okay, here we go. So from here, let's go back. Let's talk about what's going on. Okay, so employers, let's go back to the employers here. So over the past decade, an increasing number of employers have taken a similar deal using the government's Medicare Advantage program as an alternative to existing retiree health plans and traditional Medicare coverage. We just discussed the difference. Traditional Medicare is the same as original Medicare. Medicare Advantage is the alternative. Employers and insurers negotiate behind closed doors to design a private Medicare Advantage plan available to retirees from that employer. That Medicare Advantage plan is a group Medicare Advantage plan, and it's known as a Medicare Advantage EGWP, affectionately known as Employer Group Waiver Plans, EGWPs. And so it might be something to where it's labeled retiree insurance, but if it's group Medicare Advantage, it's an EGWP. All right. Then, just as it does for private individuals choosing a Medicare Advantage plan, so this is talking about individual Medicare Advantage plans, the federal government pays the insurer a set amount for each person in the plan. So each person in the plan, we don't know exactly the amount, but there's 250,000 city retirees. Obviously, since you won that case, obviously that now you get to opt out without being charged, but they're probably still going to go through with pushing that plan because it's just such a big book of business that's a term in the insurance world, a big huge book of business and risk pool for the Medicare Advantage plans get paid by the federal government. Okay, so experts say this arrangement often saves the employer money because the federal payment reduces the employer's share of the cost of coverage, but retirees' health care may be disrupted if the plan no longer includes their doctors, hospitals, and the insurer has the new requirements and charges new fees to access benefits. Yeah, the more utilization that you have, it's just well known. The more utilization that you have, medical services and supplies, if you are not, dual eligible that has Medicare and Medicaid, if you have to pay for out of pocket for the extra co-insurance or the or not extra for the co-insurance for the per medical services, it's very itemized. So like some services are more with other plans and less with other Medicare Advantage plans. And if you have chemotherapy, there's typically you're on the hook for the 20% co-insurance on these Medicare Advantage plans. That means you have coverage up to 80%, but then you're on the hook for the 20% gap of cancer treatments for Medicare Advantage plans. So look at the plan details, and when you're looking up cancer coverage on your Medicare Advantage plan. Okay, so the scores of private and public employers. Sorry, y'all, it's 11:43 p.m. Private and public employers offer Medicare Advantage plans to the retirees. Yet the details, the costs to taxpayers are largely hidden because the federal Centers for Medicare and Medicaid Services, known as CMS, is not a party to the negotiation among insurers and employers. The agency said it does not have details about how many or which employers are using this strategy or the cost to the government for each retiree group. There is no oversight, is what they're saying. Employer-sponsored plans receive billions of dollars in federal payments, but they also get something other Medicare Advantage insurers don't: automatic exemption to some requirements that apply to the policies available to individual beneficiaries. So plans can set their own enrollment dates, send member information without CMS approval for accuracy, follow weaker requirements for provider networks, among other things. So no oversight. So there are many plans as there are stars in the sky. That's exactly right. Look at this, 3,834 if you ask Google in 2022. That was kind of funny. Because employers and insurers can design their health benefits in any way they want, said Tatiana, a training specialist for California Health Advocates, a consumer group. She switched her healthcare coverage to a new employer-sponsored Medicare Advantage plan AT&T introduced this year for retirees to see whether it would save her money for better benefits. She qualifies for it because her husband was an employee for the company. These group retiree plans, also known as what are they called again? EGWIPs. Look it up. Employer Group Waiver Plans. EGWIPs. Say it with me. Okay, so EGWIPs are similar to public Medicare Advantage plans that insurance companies advertise on TV, in the mail, run by private insurance companies. They must offer benefits to government's traditional Medicare and often extras like dental, vision coverage. And like I said, it's a huge difference, though. They must offer the benefits, but it's not designed the same way, is what they're saying. And this is the difference, because Medicare Advantage program is trying to be to where they're trying to manage your care under HMO PPOs. And if you have someone that is utilizing the fee-for-service and wasting, going to the doctor and specialist for every little thing, then yes, they're going to have that. But that's not the majority of beneficiaries. The majority of beneficiaries want to live out their golden years. No one in the U.S. is wanting to have all the services and supplies that Medicare provides if they're healthy. So if they're healthy, they're going to use that. So anyhow, let's get off that tangent. However, they restrict members to a network of medical providers. Yes, back to the network. 3,834 plans, 3,834 different individual service area plans. Okay. In traditional Medicare, the government pays doctors, hospitals, and other healthcare providers directly for beneficiaries' care. That is known as fee-for-service. Original Medicare, traditional Medicare, one and the same. Original Medicare includes A and B. This is fee-for-service. This is 60% of all 62 plus Medicare beneficiaries. Right. And so, okay, so traditional Medicare, yeah. But Medicare Advantage is different. The government pays the insurance companies. Oh, we have that graph as well. Here we go. Boom. All right. The government pays insurance companies that sell Medicare Advantage policies a fixed amount every month for each member that they sign up. And sometimes they can upcode, which means they get more per beneficiary that has more risk scores or health risk scores to be able to upcode how much they get per enrollee. If you don't know what I mean by upcoding, Google it or YouTube it, because there's a big debate about a Medicare Advantage upcoding online. In most of the employer-sponsored retiree plans, the federal government is paying the overwhelming majority of medical cost. Barry, Senior Director of Health and Benefits at Willis Towers Watson. That is a big firm name. Okay, if you are a retiree and have your pension with them, you know who they are. Okay, which advises dozens of large companies and state retirement systems. That's correct. In some cases, it pays the entirety of the cost under a separate arrangement for employer-sponsored Part D drug coverage. The federal contribution and manufacturer discounts can account for the majority of cost of the pharmacy plan. Employers find Medicare Advantage appealing because they can drive significant savings. Let's listen to that again. Employers find Medicare Advantage plans, Medicare Advantage, appealing because they can drive significant savings, says Chris, principal and National Retiree Solutions leader for Mercer Marketplace and another benefits consulting group. His clients have saved up to 50% more by moving. I'm sorry, y'all, it's late. 50% by moving retirees into employer-sponsored Medicare Advantage and drug plans. 50%. I wonder what that number is. How much in dollars? Under some plans, retirees can go to any Medicare provider, he said, so there is typically little retiree disruption. Under some plans, retirees can go to any Medicare provider. They can go to them, yeah, sure. If you have a regional PPO, you can go to them. If they're out of network, you can go to them, but will they accept claims payment of their medical services? So having the ability to go to them is not making doesn't make like a whole lot of sense if the insurer won't pay that claim. So with original Medicare, the primary insurance, you just show your red, white, and blue card, red, white, blue Medicare card, and as long as they accept assignment from Medicare, they accept payment from them. With Medicare Advantage, HMO PPO, if your doctor is out of the network but accepts assignment from Medicare, they still have to contract and or agree to the payment terms for the Medicare Advantage insurance company. And so they don't have to by law. That's why doctors move in and out of network. That's why you get that. That's why you have to kind of shop your plan when your doctor no longer takes your plan, takes the payment from that plan. All right, hopefully that clarifies why this statement is not accurate. Retirees can go to any Medicare provider. They can go, but is it going to be paid by the plan? Okay, Care First Blue Cross Blue Shield, an insurer that serves Maryland, Washington, D.C., Northern Virginia, began offering Medicare Advantage plans to 4 new retiree groups this year, said David, Executive Vice President and Chief Growth Officer. Most employer groups have achieved double-digit percentage savings on annual retiree health costs. The number of beneficiaries in employer-sponsored Medicare Advantage plans has soared from 1.6 million in 2008, look at this guys, to more than 5 million last year. So in 2021, it's now grown to 5 million. There's 62 million Medicare beneficiaries. That is a significant jump. Okay, according to CMS, United Healthcare, the nation's largest health insurance company, that's right, they own 35% plus of the Medicare market, individual, and now looks like they're moving quickly in the group, has seen tremendous growth in the employer-sponsored plans during the past decade. And National Vice President Joe Altman, who we've had new groups coming into our group, Medicare Advantage, every year, Altman said. We do not divulge their names. we don't kiss and tell because we make money. That's true with a lot of things. Okay, in a typical employer retiree plan, beneficiaries are often covered by traditional Medicare. That's right, which picks up part of their medical costs. Yeah, it does. 80% of hospital and outpatient Part B is pretty big part to me, and the employer and retiree are responsible for the rest. Yeah, that's what's supposed to happen because obviously Medicare pays for so much, and it's just downplaying what original or traditional Medicare is, in my opinion. The government's payment to Medicare Advantage plans are supposed to be equal to what it would cost for beneficiaries stayed in the Medicare in the government-run Medicare, but it doesn't always work that way. That's right. And so it's going to show you what I've been saying in past videos. But in spite of the apparent relative efficiency of Medicare Advantage, no iteration of private plan contracting has yielded net aggregate savings for Medicare Advantage. No savings for Medicare Advantage. The Commission estimated that Medicare currently spends 4% more per capita for Medicare beneficiaries enrolled in MA than it spends for similar enrollees in the traditional fee-for-service. That means the direct relationship between you and your provider, you and your durable medical equipment supplier. They get paid directly by the government, not through the insurers. And then look at what it says here. Okay, so that was from the June 2021 MedPAC report from the from Medicare Payment Advisory Commission that consults Congress about Medicare. So with Medicare Advantage member, with each Medicare Advantage member, the government spends 4% more. It looks similar, doesn't it, than it does for someone in the traditional fee-for-service program, according to Medicare Payment Advisory Commission, which advises Congress. And yes, it sounds the same because guess what? I did the same thing on another video in past years, or last year. In 2019, CMS paid the plans $7 billion more than the cost of care for those beneficiaries in traditional Medicare. Oh my goodness, $7 billion more in Medicare Advantage. A study by KFF found. Kaiser Family Foundation, Kaiser Health News. Kaiser is invested in Medicare, Medicaid, in the health insurance space. They know what they're talking about when they do these studies. So click on this link if you are reading along with me. Click on that link because they have so much data to back up their claim when they say this. Much of that difference comes when the insurer reimbursements are increased by Medicare to account for services for sicker patients that are either not provided or not necessary. They're talking about upcoding. So Google upcoding, especially on YouTube. There's just a huge, not a huge community, but a number of videos that are very interesting when talking about Medicare payments to Medicare Advantage organizations, when they and the trend of upcoding or getting more cash, lump sum amount per enrollee. So it's kind of interesting if you want to look into that. Okay, a recent investigation by the Inspector General of the U.S. Department of Health and Human Services found that the practice resulted in overpayment of $6.7 billion. So wait, hold us in 2017. So CMS paid plans $7 billion more than the cost of care, and then the OIG from the U.S. Health and Human Services cited an overpayment. So they're the enforcement arm for fraud, waste, for the Medicare and Medicaid, and also the Medicare Trust Fund. So they're actually are saying that they could be collecting back $6.7 billion in Medicare in overpayment. And if you don't know who the OIG is, they are very serious in terms of getting tax dollars back that are either a part of fraud or waste, or that are a part of not utilizing the tax dollars that they're intended for. And it doesn't matter too. You could be obviously a person that's trying to scam the system, or providers within the system that are stacking everything in their favor. Like there's a number of cases out there. Just go to the OIG website, and it's kind of interesting because it's almost like, who's doing something bad in the industry. They're going to let you know because they have so many cases out there about waste and fraud. Okay, so the exemption to Medicare Advantage rules granted to these retiree plans are intended to make it easy for employers to make the switch, a provision the federal law allows Medicare officials to waive or modify requirements that hinder employer-sponsored Advantage plans. Where did we see that before? That's right. Employer group waive. They're waiving bye-bye to your group to your retirees. They're waving bye, and they're welcoming them into their old plan and waving them into the new plan. That's exactly what they're doing. Okay, so yeah, let's just read out the rest, y'all, if you're sticking with me this long. Okay, so here we go. So so recent the recent investigation. So which way? Okay, so for example, provider network requirements are watered down for the employer plans, which means finding a doctor who participates in the plan may be more difficult to members, explained David, Associate Director of Centers for Advocacy, Medicare Advocacy. Details about plan benefits and costs don't have to be approved by Medicare for accuracy and posted on the insurer's website as they do for Medicare Advantage plans sold to the public. Medicare Advantage plan, Medicare Plan Finder website, which is Medicare.gov, also admits this information since employer-sponsored plans are only for retirees from the same company. So retirees must rely on their former employer, their union, the health insurer for assistance instead of impartial sources such as the state health insurance assistance program. These are really good places because they are hassle-free. No pressure sales tactics because they're not in any way, shape, or form licensed insurance agents or brokers or companies. They're literally just talking to you about the information. So I really recommend it. There's a lot of good testimonies on the internet about state health, known as SHIP testimonials out there. So if you want to look that up. We know that these employer Medicare Advantage plans receive a great deal of federal subsidies with the cost paid to CMS and the taxpayer. But what are the strings attached to this money? What kind of oversight do these plans get? That's right, none. And back to the New York City retirees. Some retirees sued to stop the new plan, which they've won currently. And as we saw in the beginning of this video, they claim that they didn't have essential details, which is absolutely correct because they are rushed to the end of the year deadline, which I don't know. That is definitely like a high pressure tactic that these call centers do over the phone. We only have to the end of the 2021. And that's exactly what happened to the New York City retirees, but they didn't take it and they won. So including which doctors and hospitals would accept it. That's exactly right. So almost about 47,000 retirees. I think Mariana said 50,000 have opted out of the new plan, according to the spokeswoman of the for Mayor Eric Adams. And here's Mariana. So we were told that everything that this plan is doing has been approved by Medicare. Nope. And that they would have to follow all the Medicare rules. And obviously, and then you guys obviously filed the lawsuit and won, which congratulations. State Supreme Court, Justice Lyle Frank. Okay, so, Okay, city officials are assured that the judge will follow an instruction. No. Okay, Frank said. Okay, so yeah. So the change is still, if the folks that are staying on the plan, which many folks might not even know about it, the change for the New York City retirees take effect April 1st. Decision in the lawsuit is expected this week, and obviously I just got that video. I watched that video with you live kind of tonight, which is the 3rd going into the 4th of 2022. Some New York City officials are still skeptical. Oh yeah, they definitely are. Alright guys, so that's all I have. And so if you're a New York City retiree, congratulations that you guys won. I'm so happy for you guys. I'm happy that you don't have to pay some ridiculous fee to actually opt out. That's unheard of. And if you're on traditional Medicare and with your Medicare plan that you're happy with, stick with it. Obviously, there's some rules about Medigap insurance. You guys have open enrollment up in New York City. That's very important to note, especially if you're someone that travels the country and wants to be able to have coverage throughout the U.S. and comprehensive. That's very important to have the supplemental benefit. So That way you're covered. And let me see, for you retirees, oh yeah, so let me just give you guys one thing. I do a lot of research on U.S. retiree associations and systems. This is some of the research I've done with some of the retiree associations. As you can see, I've done a number of looked into a number of research for SRS, like Dominion, Battelle. Here's someone. Gosh, I forgot what the other ones are. Anyhow, oh yeah, SAG, like Screen Actors Guild, and all that's on my YouTube channel if you want to look into that, because people call me up a lot and leave long messages, which is a great thing. I want to interact with you guys. And I know a lot of this looks like research, because it is, but I'm going to be giving you guys more information that's pertinent to you retirees out there, especially the different retirement systems, because the trend is so huge. 1.6 to 5 million within a few short years. This is going to continue to trend upward, where their employers, public and private, are going to shift the employer healthcare employer retiree cost onto Medicare. So look out for that. So if you have any questions, let me know. And if you want me to do a deeper dive into your retirement, Medicare Advantage group retiree plan, let me know. I've done it for a number of retirees to compare traditional Medicare to original Medicare to their group Medicare Advantage plan, since it's not public on Medicare.gov. That's something where somebody has to contact me in terms of getting to know the actual group retiree plan and seeing what it says. More often than not, obviously, it's for savings for the employer or union, your former employer, and then original Medicare is always going to be there, is always going to dominate dominate the coverage, dominate just the way it pays the medical claims. It pays it faster than Medicare Advantage. There's no prior authorization. You and your doctor have that trust, and your doctor is able to obviously refer you without you needing a referral. Recommend, I should say, to specialists and to clinicians that you need for your healthcare on your Medicare journey. So thanks so much for watching. If you're stuck with me this long, hopefully if you're on one of these 3,834 planned service areas, hopefully you're happy with it. If you have questions, let me know. Take care. God bless y'all.